So I do want to get started because we have a lot to talk about in this hour. So first I'll introduce myself. My name is Joanna Tenkate, and I work at Global Heart Hub as their patient community engagement and development lead. I'm really excited to be here today. And for anyone who may not know, Global Heart Hub is an alliance of heart patient organizations and advocates aiming to create a unified global voice for those living with or affected by heart disease. So today, this is a part of Global Heart Hub's Empower webinar series, where we partner with patient organizations around the world to respond to the questions and needs of patients. Now, this webinar is being jointly hosted by Global Heart Hub and Serce na Panaha in Poland in support of the shared commitment to reaching and empowering the global patient community and in creating a collective voice. I want to welcome everyone to today's session, where we will be talking about mental health and wellness for all those living with heart disease, in recognition of the importance of addressing both the physical and emotional aspects of health for overall well-being. Just as a bit of housekeeping, I want to call attention to the fact that this session has live audio translations into Polish. I'm going to be putting a message into the chat for everyone who is looking for the Polish translation room. So please make use of that if that's something you're looking for. We also have automated translated captions that are available in the captions button. Last thing, I want to note that this webinar is being recorded and will be made available online after the event. Now, with the housekeeping out of the way, I'm excited to introduce our speakers today who will be covering this important issue. So we will first be hearing from Dr. Anna Mizhinska, a clinical psychologist specializing in the treatment of chronic diseases and heart disease. And then we will get into a discussion with Anna and two cardiovascular disease patients and community advocates, Jackie Ratz from Canada and Marcin Rusinski, who leads Serce na Panacha in Poland. And they're going to be offering their insight and their advice from their own experiences, not only as patients themselves, but as organizers of peer community support. Now, to get us started, I'm going to go ahead and hand it over to Anna for her presentation.
Thank you, Joanna. I hope you can all see me and hear me. And I would like to thank you all for the invitation and this opportunity to share some knowledge and also maybe also listen to your concerns regarding mental health. This is really close to my heart, if I can say this, because I'm a clinical psychologist working with cardiac patients for, well, almost 20 years already. And this is something I hold dearly for my clinical practice. And I would like to start off with saying that if we think about being healthy, usually we think about being able to have productive life with the high quality of it, without any ailments or symptoms or pain. But health is so much more, and mental health is an important part of it, among other aspects like spiritual or environmental. And this is the one which refers to way we think, we make our choices, we feel, we act on a daily basis. So this is the aspect of our life which is really connected to how we feel and how we also connect to ourselves and others. And since cardiovascular health is really connected to how we behave and who we are, we have now gathered many evidence and much data on how it can impact our health and especially our cardiovascular health. So for many years already, we know that mental health is highly and significantly associated with the onset of heart disease, and not only with the risk, which is important, and I will talk about it later, how having some mental health issues and some emotional problem can increase the risk of developing cardiovascular disease. But also it's important when we already have the diagnosis, when we start the treatment, because it can influence the way we act during the treatment, how we adjust to the treatment, and how we think about ourselves as a patient. And those pathways, those mechanisms can occur from both ways, from our physiological way of being and acting, and also from our behavior. And it's worth knowing that they both are really closely connected to each other. When we think about our body and how it reacts to our life, it's really important to understand that our body is this wonderful and really wise self-regulating mechanisms. So we have the mechanisms like the regulation, which is related to autonomous neural system, which can help us to prepare ourselves to face every potentially threatening situation, every new situation. And we call it the fight and flight response, or now we call it fight, flight, and fright response. But it's important to understand that this reaction and this response, it's really automatic. It doesn't react, and it really reacts to how we think and what we experience in our life. But the crucial part is that this pathway, this response, is really beneficial only when we face certain acute stressors, when we face the situation that we can overcome, the problems we can solve, because it causes our body to react. And then when we have the solution, it makes us to calm down and cool off. But unfortunately, the way we live now, the way how society works, makes us face different kinds of stressors, because the stressors we are facing nowadays are mostly social and psychological, which means they are chronic, they are really often uncontrollable, and often they are affecting many areas of our lives. And as a result, because our body doesn't know what kind of stressor it is, it makes our body to react constantly. And our body then can be in the constant alert and being prepared for potentially threatening situations. And we cannot live like this for a longer time. During stressful situations, our body products the whole cascade of reactions. Among all, it affects the cardiovascular system. It can cause increased cardiac reactivity, like increased heart rate and increased blood pressure, but also, as an effect, it can cause decreased blood flow to the heart and also increased cortisol level, which is known stress hormone. It's fine when we occur this situation and this experience once in a while, but in reality, we face this kind of situations over and over again, which causes many damages to our heart, to our body, among all metabolic diseases and also heart diseases. So this is something we have to remember when we try to treat our patients, when we try to also prevent developing cardiovascular diseases. But also, we have to remember that the onset of disease and starting the treatment is the stress itself. It causes stressful situation and causes stressful reaction for our body. What does it mean? It means that when we are facing the symptoms and when we are receiving the diagnosis, we should face a new and potentially stressful situation. For many patients, and we really as a medical team should remember this, starting the treatment, it's not only a medical event. It's not only a medical situation, but also it is a major life event. And it can cause confusion as how we should act and how we even should feel towards the situation, towards our body, and towards the changes that occurs in our life. And many people who are learning their body at the situation, learning how it acts after the cardiovascular event, tell me that they are not really sure how they should feel emotionally, and whether the emotions they feel, they experience, are kind of normal or usual in this situation, if they should be treated for how they emotionally cope with this. And this is quite important because if they feel that the emotions they are feeling are unique, not normal, they could have some difficulties in asking for help and asking for support. And I think that we already know, and I hope that you all know, that experiencing negative emotions and experiencing difficult emotions are quite common, especially after being treated and after receiving the diagnosis of cardiovascular disease. And we also have some research to support this. We know that after the receiving diagnosis, after the first onset of the disease, people feel and face the whole range of emotions, the whole range of thoughts and behaviors. And it's worth noticing that majority of patients after the cardiovascular incident are feeling anxious, are feeling upset, scared. They can feel depressed. They can feel really struggling. But what's worrying the most for me as a psychologist is when a patient who is struggling with negative emotions also has the thoughts of being isolated, of being not understood, of being alone with this experience. And this is also quite common, at least to the moment when we try to talk about this, not using medical terms, but using psychological terms, using common language and the language of everyday experience. So if you are experiencing anxiety or sadness, if you are scared, you must remember that you are not alone. When we think about patients, we also try to remember that each of our patients is unique because it comes with different backgrounds. It derives from a different age and different resources and different personality even. But there are some people who can feel more emotionally affected by the disease. And usually we try to focus on them more. We try to help them more because we know that those factors make them more vulnerable to stress and to negative emotions after diagnosing the illness. So the first factor is age. And surprisingly, to many people, it's not the young people who feel the most affected, but the people who are around 60 years old, people who feel that they are too young to retire, especially if they are full of life, if they were really full of joy prior to illness. But also they feel too mature to make major changes in their life. People who are really vulnerable are also those who don't have strong social connection, who don't receive adequate social support, who feel lonely, who don't have friends, who don't have strong bond with their families. Also, having low income can be an additional burden when you are facing a treatment and illness and its consequences. And also, which is for me the most important factor as a clinical psychologist, is also experiencing and being treated for previous psychological problems. if you are depressed and you are being treated for depression, you not only have the higher risk of developing cardiac problems, but you also can react with worsening of depression symptoms. So it's worth remembering that those are the groups we are trying to focus more. Of course, we also know that many people will adjust with time. Many people in the following months will find the joy again, will find hope, will find a way to adjust and new strategies to help themselves. But also we have to remember that among cardiovascular patients, there are many who will struggle, even after many months or even years after the incident. So just to show you some numbers, if we think about depression, which is quite common even in healthy population, if we usually have 10% of people with depression in the overall population, we should remember that among patients with cardiovascular disease, this is 3 times higher usually. It depends also on the symptoms and on the burden of the symptoms. But usually, as you can see, many people with cardiovascular disease face some depressive symptoms as well. Many also have high anxiety and anxiety disorders, and it's up to 1/3 of patients, even many years after the incident. There is also a growing number of research showing that PTSD, post-traumatic stress disorder, is also important and prevalent in cardiovascular population. Well, I hope that the data doesn't show that we are causing PTSD for our patients. And usually we don't, we try to help. But we also see from this research that experiencing PTSD, so experiencing traumatic events in your life, can really increase the risk of developing cardiovascular disease. So this is a significant risk factor and should be treated along with the cardiac event. Of course, we know all this and we are trying to help. But even if we know how many people will struggle and how many people will need our support and treatment and help, still many of them doesn't get it. And the barriers which prevent us from showing this help and giving the support can derive from many factors. And first of all, of course, is how the healthcare system operates. Many patients say that cardiologists and even general practitioners don't have time to talk about mental health. Also, medical professionals emphasize that they have limited time, and when have this time, they have to use it for focusing on somatic symptoms and the treatment. Well, personally, I believe that asking few questions and using this time with patients really well could save the patient and the loved ones many years of struggles, many years of low quality of life, and it's really worth asking. But the other part of the barrier is lack of confidence in the knowledge. Many cardiologists I work with say that they don't feel confident about being able to diagnose and treat mental health problems. They don't know how to recognize symptoms of depression, how to recognize anxiety disorders, and not even mentioning PTSD. Some of them are trying to treat insomnia in patients, but usually it also requires additional help from the mental health professionals. So this is an important barrier. We are trying to teach medical professionals. We are trying to tell them that there is no time to waste during even those short visits. They should ask and they should provide patients with support, and some treatment options. Additional barrier from our side as medical professionals is more logistical one. If there is no mental health specialist in the team or even in the area, it's difficult to consult patient, it's difficult to ask for support, and difficult to even propose the treatment to the patient. So this is something we really should address, and we hopefully will be able to address this in the near future, especially in Poland. But not only the healthcare system could provide some barriers, because many patients I'm talking to and I'm asking about the mental health are really resistant to acknowledge the role of mental health in their overall well-being. And this is quite common because when we talk about their feelings, about their health, they tend to prefer using terms which are not related to the clinical diagnosis. So they say that feel frustrated, they feel angry, they feel tired, they cannot sleep, and so on and so on. But they refuse to describe themselves as depressed or anxious. And I think it's related to being afraid of having this etiquette of someone who requires additional help from the mental health professional. There is still a lot of stigma around this theme and around this kind of support. Although, and this is the other part of the same story, many people who are struggling even for years, when they receive the diagnosis, they say they feel kind of relieved, because this is the moment when they can feel more understood, they can be more hopeful for the treatment, and also they say they are happy that their feelings, that their struggles, their burden has a name. With the name comes the hope for the treatment. So this is something we should remember. Apart from being hesitant to acknowledging the mental health issues, many patients also have and face some difficulties with engagement with mental health services. Some of them are saying that they don't want to receive this kind of help. They are not interested in talking to psychotherapists or psychiatrists, or even they say they feel our help wouldn't be really beneficial. And this is usually related to the lack of knowledge. There are so many incorrect beliefs around mental health services. And usually after a short conversation about what does it mean to receive this kind of support, patients agree to use it and are really happy to receive this kind of help. Other part, and this is something I really would like to remember, is that the belief that you are helpless and hopeless in your situation could be also a symptom. Depression works like this kind of force who can prevent you from looking for help. So if you feel hopeless, if you feel that no one can understand you, and you cannot receive good help and adequate support, it could be also a symptom. So please be mindful of this. That's the thing I stumble upon, I think, the most. But also, and this is something that occurs when I consult the patients as well, is the attitude toward us, mental health specialists, so psychiatrists, psychologists, and some people are just afraid to open up in front of the new person. It's quite understandable. If you are willing to be vulnerable, you want to feel also safe. You want to be able to trust the person. And it's difficult to trust someone who is a stranger. So some people are afraid of being judged. Some are afraid that they will be assessed as someone who is not coping good enough. And this is really far from the truth, because we are not there to judge you, we are just to help. And it's really important to remember that sometimes it's easier to open up in front of someone who is not directly involved in your daily life. And you don't have to think what we are feeling when you are sharing all those emotions. We are here just to help you cope better. The other part about the judgment from the mental health specialists occur when the psychiatrist or psychological assessment is mandatory during the treatment. It happens, for example, during the heart transplantation qualification. And working in this setting for long years, I learned that there are some people who are trying to hide their struggles because they are afraid that being open about their mental health issues will make them not receive a heart transplant, for example, or some kind of a treatment. And this is so not true, because being honest and being open about your struggles not only will help us to provide adequate support and treatment for you, but also you should remember that if you are facing this kind of psychological assessment, the one of the most important areas of this evaluation is being honest and open and willing to collaborate. So it's better to share and better to get support than try to hide it. Many people who are sharing with me their emotional struggles also say that if they could choose, they would prefer more informal support. And this is, I think, quite natural, because usually when we are thinking about receiving support, we are more willing to talk with our peers, with our family, with our friends. And I think that's not mutually exclusive. And I think that we can benefit from all kinds of help and support. And being treated and having a psychotherapist doesn't mean you necessarily wouldn't get support from your family. I think that the family plays a really crucial role in the therapy as well. So if we're facing some logistical financial issues, which are quite prevalent, and I think we all know which those are, there are so many solutions right now regarding mental health applications for the phones and online psychotherapy, group programs, and nonprofit organization activity regarding mental health. But also, and I would really encourage you to ask about this, not only psychiatrists, especially in Poland, can start the treatment for mental health problems. In Poland, we are able to provide the treatment for patients with cardiovascular disease and depression in cardiology office and also in general practitioner office. So it's worth trying and asking if in your country, in your setting, it's also possible. But you know why it's all important. I told you previously that the stress, the constant stress, is harmful for heart. But why it's important to address mental health issues? First of all and foremost, it's the quality of life. If we feel well in the emotional aspect, we are dealing better with our daily tasks. We have better social life. We feel better about ourselves, and we can cope better with everyday struggles. But also, in the context of cardiac treatment, the mental health issues can also interfere with the way how we collaborate with each other. They can prevent us from following medical recommendation. They can decrease the motivation of sustaining healthy lifestyle. And consequentially, they can affect the treatment. So it's important not only for the well-being, but also for the effects of the treatment. And it's worth remembering. So how we do it? First of all, and this is something which is challenging for many of us, not only cardiac patients, but people, be mindful how we feel emotionally. What do we need to feel safe, to feel calm, to feel appreciated, to feel important for the loved ones? We should remember that the mental health can be prioritized and should be prioritized as well as the somatic health, but because it's so strongly connected. And also, you can give yourself the right to talk about this and ask for support, especially if you feel that you need it. First of all, when we are trying to help our patients, we emphasize the role of the family and friends. Because the human connection and the support and the relationship we have substantial value and can have this crucial impact on our quality of life and how we cope with our health, with our treatment, and with our life goals. So please try to be open about your needs. Don't be afraid to ask for help. And also, could be difficult for many patients, for many people who are self-reliant. Try to be open and accept the support you are given. Also, try to remember that for us, as a medical professionals, your mental health is important, is a crucial part of your well-being, of your overall health. So we tend to see your struggles, but not always we are ready to start the conversation, especially if there is no psychologist in the team. So please remember that we are here to help. We are willing to help. We have tools, we have experience, we have knowledge that could be really beneficial for you. But please give yourself the right to tell us about your struggles, and let us help you if you need our help. So when we know that something is happening, it's worth looking for help. But not every moment means, and every struggle means that you are facing mental health problems. It's okay to feel emotions because all of us feel emotions. This is the way we react to every situation, to every life experience. But if you feel that the symptoms, burdening symptoms like depression, anxiety, sadness, fear, occur over a longer period of time, more than 2 weeks, more than a month, for some people more than 6 months even, it should be a warning sign. If you cannot sleep, if you feel sad all the time, or weak, or disinterested in your life, that should be a reason to talk to someone. Also, if your emotional well-being is interfering with your daily task and self-care, if you don't remember about your friends, if you don't want to take a walk, if you don't want to engage in the activity that was pleasant for you, that's also a signal you should be more mindful of your mental health. Also, if you feel that your resources and your usual ways of coping are not enough, that someone could help you look from a different angle. And how to recognize. I told you about those three, the most important and the most prevalent problems. So of course you don't, you cannot treat it like a diagnosis, but this is kind of overlooked to the to the most common symptoms. First of all, depression is not a sadness itself. It's a serious chronic illness which can increase the risk of cardiovascular problems and then increase the risk of not coping well with your disease. So how to recognize depression? First of all, you can recognize it by seeing that you are not interested in your own life. The situations and events that were engaging and pleasant are not anymore. That you are constantly sad and anxious, that you feel weak and without energy all the time. When you have problems with sleep, with the appetite, and if you have many negative thoughts about yourself, about others, if you feel your self-worth is low, or your self-esteem, or you have negative self-image, those could be the signs of depression. For the anxiety, it's worth remembering that experiencing anxiety is like experiencing constant stress. So feeling anxious, on edge, feeling nervous, feeling this emotional tension in your body and in your mind. In anxiety, it's really common to have this feeling that you cannot control your worrying, that you have worrying thoughts all the time and you are not able to stop them. You can also experience some somatic symptoms like sore muscles, stomach ache, headache, or problems with respiration. Also, heart palpitations are quite common as a symptoms of anxiety. For the PTSD, it's worth remembering that it can occur after shocking or overwhelming event. And if you have PTSD, you should really look for support and help and treatment. This is a serious event, serious disorders which can disrupt your life. And people who experience PTSD say they feel really detached and numb on a daily basis, but at the same time, they are very vulnerable to even mild stress. They often experience intrusive thoughts and images about the traumatic event and are trying to avoid each situation and each possible event or place which could remind them of the traumatic event. So if we know that we have this kind of diagnosis, what can we do further on? Because from the clinical perspective, we have few pathways. We can offer you medication, which can make you feel better. We can offer you psychotherapy or psychological counseling. And for each patient, it would be slightly different because we are different, because we prefer different things, different ways of helping. But the one thing I would like to emphasize the most is to prioritize your self-care and social connections. Because apart from the treatment, the way how we take care of ourselves have the crucial impact, major impact of on our well-being. So using this social support system, being around people who make us feel better, who make us feel loved and appreciated is really important. And also be mindful of our daily habits. So being really mindful of our self-care, because having healthy minds, having good mental health requires also taking care of our body. So being mindful to 4 major rules. First of all, be mindful and be courageous and open about your feelings. And if you need support, just tell us, tell your loved ones, tell a medical professional. Make sure you will have time to relax, to restore your strength during the day. It could be a small walk, could be a cup of tea, something to tell you that you are having the time for relaxation. Remember about physical activity and remember also about your diet because it can influence how you feel somatically, but also it can have impact on your mental health. Thank you so much for the attention and for the opportunity, and I hope that we will have a great discussion.
Thank you so much, Anna. That was a really great discussion, and I'm really appreciative of you being here. Such a comprehensive overview of not just the mental health challenges, but also the strategies for patients, and I really appreciate having your expertise on this call. I'm now really excited to turn to our discussion and to Jackie and Marcin, who I'm so grateful to have with us today to share with us their perspectives and the tools that they have gathered from their own experiences. Now, Jackie, if I could start with you, would you please introduce yourself and maybe tell us why this topic is important to you?
Thanks, Joanna, and thank you, Dr. Anna, for such a great presentation. My name is Jackie Ratz, and I live in Winnipeg, Manitoba, Canada. By living in Manitoba, I acknowledge that I am on Treaty 1 territory, the traditional gathering place of the Anishinaabe Cree, the Ojibwe Cree, the Dakota, and the Dene people, and the traditional homeland of the Métis people. I am the founder of the Canadian Women with Medical Heart Issues Facebook group. We have over 1,200 women that are now part of our group right across Canada with all different types of heart disease as well as heart failure. And I also am a Heart Life champion for the women as well as for Manitoba. And I'm very proud of that association that our Canadian Women's Facebook group is part of. And we've just launched an in-person support group as well. And I'm very excited about that. The work that Heart Life does is really changing the dynamics of care in Manitoba as well as in Canada. I also am part of the Canadian Women's Heart Health Alliance here in Manitoba, but also Canadian-wide. And it is an organization for researchers, clinicians, trainees, patients with lived experience that get together and we move the needle by creating objectives that we succeed. Recently, we've been published for the Canadian Atlas. It's 9 chapters of why women are different than men. And other than that, I am also a wife, aunt, friend, fur mom, and I've been living with heart failure for close to 9 years now. My heart journey actually, unbeknownst to me, started when I was 24 and I was diagnosed with non-Hodgkin's lymphoma. 20 years forward, I would develop chemo-induced cardiomyopathy, and 4 years after that, I fell into heart failure. For me, the need for having supports was critical to my own well-being. I felt so isolated, as Dr. Anna had mentioned, and felt so alone. And by creating a community of women, I found my tribe. I found my raft that saved me and made sure that I was able to go on and become successful and live well with heart disease and heart failure. Thank you.
Thank you so much, Jackie. I'm really excited to have you here with us today. Now, Marcin, if I could turn to you, would you mind introducing yourself for us?
Okay, thank you very well. First of all, I'd like to say that Anna was your presentation was amazing, really amazing, and I please share with me your presentation. I will share it in my social media. My name is Marcin Ruciński. I'm from Poland. Since 2003, unfortunately, I am a cardiology patient when I had the flu, and after that, I had myocarditis. Since 2005, I have a pacemaker. Yes, I am also president of Cardiology Association for the Patient with Cardiovascular Diseases, Serce nad Banacha. This is Polish name. English name will be better heard of Banacha. Banacha is the name of street when in Warsaw, where is placed hospital, cardiology clinic. Also, I am the programmer, developer, and also I'm the teacher of medical academy where I had lessons with the students about the medical communication and propedeutic. And I think I am here. I know from my experience, from my meetings with many people that physical, mental is very, very important during the cardiovascular problem for everyone. Yes, and I hope that this meeting will be very helpful for everyone. Okay, thank you.
Thank you so much, Marcin. I'm really appreciative not just of you being here, but your organization partnering with us on this webinar. And then I'm going to transition us right into the discussion because I know there's a few different topics we want to talk about today. So just to get us started, we hear that the early days following a cardiovascular disease diagnosis or event can leave individuals feeling overwhelmed and, like Anna said, isolated and unsure of what steps to take next, especially if they're completely unfamiliar with the landscape and they really don't know anyone else to turn to. Some people might feel lost and uncertain about how to navigate what is essentially a new reality for them. So, Jackie, if I could start with you, what advice would you have for patients who are grappling with these initial feelings of confusion and uncertainty?
I think the very first thing I would say is to be really gentle and kind with yourself. Number one, because it is a journey. You can't expect to be able to dive in and be able to go through this process and learn everything that you need to learn or try to navigate it. Having feelings of being angry or sad or confused or overwhelmed are very normal when you get a diagnosis of either heart disease or heart failure. So the first thing to do is take a big deep breath, know that you're on a journey. It's not going to be a 1, 2, 3 step process, and just to take some time to digest that. Next, I urge you to speak with your cardiologist or your family doctor or your nurse about resources that might exist for you within your own country, within your own region. Certainly step online if you're a Facebook user or if you're on online, look for groups that can be social supports for you. And don't shy away from reaching out and saying, I need help. I'm getting lost. And that is such an important piece of this. And if you find that you're getting resources that, or getting a doctor that isn't going to be willing to listen to you, then speak up as well and be honest with them and say, I need you to hear me. I need you to really hear me. So those are a few things. I'm sure that Marcel will be able to add a lot more.
Thank you so much for that. And it actually brings me to the next question, which I'd like to direct to you, Marcin, which is related. So we know that, in those moments of grappling with a diagnosis or with treatment, patients can look to their social support system and the community around them, but that's not always easy going. It can be challenging to communicate with friends, family members, and the communities around someone so they really understand the limitations imposed by cardiovascular disease and what it has, done to their mental health. So, Marcin, what key messages would you like to convey to the support networks around patients to help them better empathize with and support them during moments of adjustment?
First of all, I would like to say that you are not alone. Yes, because many people after they takes the diagnosis about the cardiovascular diseases or heart failure, for example, or arrhythmia, or after heart attack, they thinking that I am alone. What I can do, what I can live, etc., etc. Yes, and when I was in hospital as a patient, then I saw many sad people. Yes, after the treatment, after the surgery, etc., etc. And when we talk about anything, about the waiter, about the political situation, about the movies, then I see that they can open mind, and they can open feelings, etc. And anymore, yes, and big importance words is that you are not alone. We are family. When we are together, then we are stronger. Yes, please don't close. You can live. You can live. You can live with your health problem. Yes, of course, it depends of level this problem. This is important also. Yes, but when we met together, then we'll be better.
Absolutely. So sort of finding the people who can meet you where you are, connect with you on the things that are still bringing you joy and making you feel safe and happy, and using that as a way to build your social support. But you also touch on a really interesting topic, and actually I'd be curious to know your thoughts on this, Jackie, which is when a cardiovascular disease patient perhaps has a condition that is manageable, or they haven't had, say, a traumatic event, perhaps the people around them are going to think, they must be fine. Everything's okay with them. They're not going to have any mental health problems because they didn't experience something necessarily traumatic. How would you respond to that? And what would you want people to know about that?
That is such an important piece of perception, right? I mean, like I always, I often make sure that when I go see my cardiologist, I have no makeup on. Don't judge me for how I look. Listen to how I'm telling you I'm feeling. And that is a really big step just because a person hasn't had a traumatic event doesn't mean that they're not suffering with mental health issues. I myself have never landed in hospital with my heart failure. I'd be considered a successful heart failure patient. And I look well. It's not something that you can see. You can never see my CRTD scar. It's always covered. And for the most part, I really don't show the signs of being so unwell. And yet my EF is below 30. So I know I'm not well. There's a very strong woman here in Canada, and she once said that, you know, for after she went through her event, she got her pacemaker and such. For life for everyone else went back to normal, but not for her. And, you know, and she lives with it every single day. And I agree with her. I live with my heart failure every single day. It never goes away. I wake up in the morning, the first thing I have to do is take pills. You know, the next thing I have to do is watch my water intake, and I'm watching my sodium. I got to make sure I get my exercise. It is an ongoing journey with living with heart failure. It doesn't fade. So I would say that when you're talking to your family and to your friends and such, and they want to understand a little bit better, please look up the spoon theory. The spoon theory is a methodology of how it is to live with a chronic illness. And it really does help to explain. When we wake up in the morning, we're usually waking up, let's say, with 12 spoons. Just the act of getting out of bed, and this is something that Dr. Anna touched on, is the struggling to get out of bed. It can use up 2 spoons. So that puts us to 10. You shower, that's 3 spoons. You want to make coffee? That's another spoon. So by the time I've even started my day and I'm looking to try to go for a walk, I may have already gone through half my spoons for the day. So we have to be very careful with how we use our energy. And that is a really great tool for friends and family to try to help for them to understand what it is to like to live with heart disease and heart failure.
Absolutely. And I think that the more the social support network around somebody can understand those kinds of limitations, the more they can empathize with a person who is struggling and provide them the support they need. You also touch on an interesting point, which is when clinicians, you know, of a care team might not understand the importance of mental health. And I'm seeing other comments in the chat saying, you know, my clinician, you know, doesn't prioritize this, or it's not something that they want to make, you know, as a part of my care plan. And Anna, I'm curious to see your thoughts on this as you work in the clinical space. What advice would you give to patients who are struggling to be heard about mental health with their clinicians and their cardiologists?
First of all, it's something that Jackie said that really touched me, and it's really close to my observation. Cardiac patients don't have their symptoms written on the forehead. They usually look really healthy. And this is so deceiving for the loved ones because they tend to not really believe in their mental health issues, in their everyday struggles. I know what you are meaning by those spoons because I've been working with heart failure patients for many years. And I understand that it's such a struggle to just live and care of yourself on a daily basis. So I think that the first advice I can give is if you feel that the medical team doesn't prioritize your mental health along with the somatic health, you should do it. You should request for a consult. You should require support because we also learn that this is important. I have the huge pleasure of working within the team who understand this. But this is quite rare, and I understand that this is quite rare. Because when you have a psychologist in a hospital team, I work among different teams, and one of them is cardiac surgery team. It's not common to have a psychologist there. And we have one. So it means that someone along the way thought that people are struggling. And it makes the availability of psychological support something quite common in the clinic. And further on, help patients understand they can ask for help. They have the right to require the help. They have the right to talk about their struggles, their mental health issues. So this is something I could tell you. You have the right to ask for it. And this is something which is a part of the journey and self-care, even to learn that your mental health is important.
Absolutely. That's a really great comment, Anna. And it also kind of calls to mind for me that some patients report that they can struggle to push on a clinician because they feel like they're kind of sitting in a position of power. They're the ones who are deciding on their care journey and they don't know how to push. But then at the same time, it's your health, it's your future, and you have every right to ask for additional support that you need. And it actually does bring me to my next question, which was about how, for some people, actively engaging in understanding their condition and participating in shared decision making, which is really collaboratively working with your care team to make treatment decisions, can actually lead to improved mental health outcomes or a feeling of empowerment for the patient. So, Marcin, I would be curious to know if that sounds true for you or for the patient community that you have built. Does that resonate?
Yes, how I can say it? It's maybe it is simple, but sometimes it's difficult. Yes, because when I had have some meetings with people with cardiovascular problem, with heart problem, yes, then I see that some people feels that they are lost. Yes, yes, and when we start discussion about feelings, about the health problem, any problem, life problem, incomes, budget, finance problem, then I see that mind of these people are open. Yes, and our discussion goes to positive signs. Give it to positive signs for everyone, not for me, but for them. Yes, and I see that this is very, very important that we can talk when we can talk about everything, about any problems, any signs. I don't know how we can feel like family, typical family, social family. Yes, of course. For me, they are. I don't know who is. Yes, who are. Yes, I met with him first time, maybe last time. I don't know. Yes, but I see that this is very important for them. For them, for example, when I had meetings in hospital together with the patient of cardiology clinics, that one patient has ICD defibrillator. Yes, but second patient waiting for implemented. Yes, and I feel that the second patient feels the fear. Yes, how I can feel will be live together with these devices. Yes, maybe I will be die. But when this patient start discussion with the first patient which have these devices, then I see that fear from first second patient go out.
So it's, you know, it really does come down to treating patients as individual people and not as a block. Every person has their own journey and their own story. We've only got a couple minutes left, but Jackie, if I could come back to you for 30 seconds before we wrap up, I really want to touch on that, you know, social support that we've been talking about so much. You have built a community of people who can provide that peer support, not necessarily just as friends and family, but from people who understand and have their own experiences. Can you talk a little bit about how important that is and how it contributes to actually breaking down some of the stigma or the barriers around mental health?
It is, it's amazing when you're in a safe, private group where you can share without fear of friends and family not understanding. Women have a tendency to then open up a lot more. So we can talk about our fears. We can talk about the anxiety. We can talk about the frustrations that we have with our medical health system and our clinicians. We can talk about the fact that, waiting on test results and waiting on getting tests done, and the anxiety that that can bring on when you're sitting there and when you have no control over when that's going to happen, and to realize that I'm not the only one that feels this way. This isn't just me. to understand that, women are concerned about they're raising their kids. I mean, what does this mean? I don't have the energy to play with my children. Well, here's some tips women can share together. So those are a couple of things that make a difference. And then the other thing is that the big part of what happens too, we call ourselves the Heart Warrior Queens. And we do that because we live boldly. We love boldly, we love boldly and we live bravely as a warrior does, and we are stronger together. And so Heart Warrior Queen represents that. And one of the things that we really emphasize is knowledge and learning to be able to learn about your condition, learn about your medications that you're on and the interactions, and learn about how best to utilize your treatments for your own care. What are the optimal therapies that you should be taking? We all share that. We never give medical advice, but we share from a place of love and from a place of understanding and a place of support.
Absolutely. Thank you so much. That was a wonderful way to end the session. We're really at the hour now, so I do want to thank all of our panelists for joining us today and sharing their expertise and their experience with us. I got a lot out of this discussion, and I really appreciate you all being here. I'm grateful as well to have been able to partner with Marcin and his organization, who brings a wealth of experience and expertise from his work. Thank you as well to everyone in our audience. I hope this was valuable for you, and I appreciate you spending this time with us. You should see a survey for this webinar after exiting, which I hope you'll take the time to fill out so that we can continue to improve. I'll also note that we'll be sending out a recording of today's session and the slides to all attendees. For anyone interested in learning more about our work, I encourage you to reach out to me. Thanks again, and I hope to see you at our next webinar. Goodbye.
Thank you very much. Take care.